Hey guys, so made it to the parking garage now. Just we're a few minutes late here, but that's okay because it's a hospital job. I get paid going a few minutes late or a few minutes early. So anyways, it's not about necessarily the time, it's more about the patient care and how I go about my business. So first, gotta go check in. It's COVID time, so wearing the masks and make sure I don't have a temperature, and then we'll see how the day goes. Okay, no fever. I got a new mask, and we're back in business.
We have 2 ears and 1 mouth, so we can listen twice as much as we speak. I encourage you today to listen well. Have a great day.
I didn't look at the list beforehand because I just want to go into the emergency room environment with a clear mind and not get too worked up or anxious about it before my shift. And so when I walk in, there's 7 people ranging from ages 19 to 65. And so typically in this psychiatric ER setting, I'm just going to decide whether they need to be in a psychiatric hospital or not. So one person came in who's suicidal and psychotic after using methamphetamines. Another was sitting in the emergency room for a few days because they thought he had bed bugs or scabies. And then when they realized that he didn't, he came in over, and he initially presented to the psychiatric hospital for an evaluation, but the psychiatric hospital wanted him to get medically stable first, so they sent him to the medical ER, and then from the medical ER, after he's stable, they want to send him back for the psychiatric eval or hospital. The psychiatric hospital typically may not take him back, and so he came here instead. Another patient is on a psychiatric hold or 5150 hold for psychosis and agitation after using methamphetamines. Another person also with psychosis and setting of methamphetamines. Another person who's a bit younger is overwhelmed due to family and financial problems. And then another person with psychosis, which is another term for reality impairment. So then also there's people from the emergency room that are going to come over here later this morning. Also another patient from an outside hospital emergency room who was supposed to come but later did not. So the first person I met with actually he was really nice. He was just having voices that were telling him to kill his mother that he couldn't shake, and he was interested in how long these would be there, how they would go away. And I told him that it could go away through medications, through listening to music, or prayer. Another person that I saw in more detail, they were convinced that their husband killed their son, and that she found out a few days ago from watching the news. So also, if you notice, I'm not wearing a tie because in the psychiatric emergency room setting, or even sometimes with all psychiatric patients, it's recommended to not wear a tie because if a patient is agitated or upset, they could theoretically choke you with it. It's not something I've ever come near to, thankfully. Also, there's no agitated patients, thankfully, so far today. The closest time recently that had someone who was agitated was maybe a few weeks ago, in a setting of they're using drugs, very paranoid, didn't want to be in the hospital, and family wasn't really willing to take them back. And so in a conversation we had, they got really upset with the conversation with the family member and hit the phone off onto the floor. So, well, life of a psychiatric ER physician. Yeah, Oh, it's just a urine analysis to see if there's a urine infection or not. So just a UA. Yeah. All right, thanks. Bye. So sometimes you get phones coming in and off from nursing staff, from other ER physicians, sometimes a lot of goes on. And it can be very detail oriented, not something I'm accustomed to doing. I'm more a big picture, holistic type feel, but sometimes the details are important, so gotta take care of those. So also since COVID hit, when I'm interviewing patients, do so with a mask, and also in the hospital setting, they have us wear these goggles because I guess it's less likely for COVID to be transmitted this way. So it'd probably be important to talk about what conditions people can be held against their will. And this is a picture of a 5150 form. And basically it's a legal document that gives certain people, like mental health professionals or police officers, the ability to hold someone against their will if, due to a mental illness, they are appearing as a danger to themselves or to others, or so impaired that they cannot take care of themselves. So it's always important to take some breaks, even though today is not that stressful, but being in one place for 10 hours is stressful, so kind of nice to come out here, check out some of the scenery, and anyways, it's important to come out, take some breaks, so I go for walks every once in a while. Thankfully in California weather, even in the wintertime, it's able to do this, but I know in some places like New York may not have had that luxury. But even while taking some breaks, sometimes you have your mind wondering about the cases that you see during the day, if you're doing the right thing, if anything's going to come up, like a call from the emergency room or an agitated patient or something happens. So it's sometimes the days can be pretty calm and peaceful. I'd say today is one of those days. Yet at the same time, it's still stressful because you're always sort of anticipating something can happen. So you always gotta be ready. But the main thing is safety. Is anyone acutely threatening anyone or threatening themselves? Everyone's today, thankfully, is pretty calm, receptive to be there. So as you can tell, some of the good parts about working in a psychiatric emergency room, I'm getting paid right now still. I get paid hourly, and I'm going for a walk. So that's a pretty good deal. So the pay is pretty consistent. I don't have to worry about billing issues and things like that. There's a lot of other support staff there. There's nursing staff and social services. Some of the cons about it are sometimes people there can get very agitated or upset, and they don't want to be there, yet it's part of the treatment. Because I guess the best analogy I can think of is like someone who is due for a surgery, or they have a surgery, like to remove an appendix, and they're going to be in pain after that treatment for a little bit. But that pain was necessary in order to take away the disease. And sometimes with mental health, also there can be a little bit of pain or discomfort. So a lot of times people don't really know why they're there or don't want to be there. but it's a necessary part of their treatment in order to get better. So far it's about midday, actually more than that, almost 6 hours into the shift. Got 3 people being transferred to a psychiatric hospital, waiting about the other ones to see if a psychiatric hospital will take their case. Thankfully not too many people agitated or aggressive or really wanting to leave. I guess too much methamphetamine use though, and methamphetamine causes people to get psychotic, mood problems. They just can't take care of themselves that well, and I'm sure it's a strain not only for them but their family and loved ones. So any words of wisdom to the kids out there: don't use drugs. Well, thanks for watching, guys. I hope you enjoyed this video as much as I enjoyed making it. Another thing I think I would like to add, just the beauty pageant statement, is that one of the best part about working as a psychiatrist is the opportunity to help people suffer less, and that is probably more rewarding than the any other aspects of the job. So stay tuned. We'll show you a little bit of what other psychiatric settings are like, and for more videos.